Have you ever felt a minor ache somewhere in your body and told yourself it's probably nothing? As we get older, we tend to brush off little pains. We think it's just age catching up with us. Maybe we slept wrong or lifted something too heavy the day before. But here's the truth sometimes. The smallest aches in very specific places are actually your body's early warning signs. And the cost of ignoring them can be far greater than most people realize. In this video, we're revealing 8 areas of the body where even the slightest discomfort could mean something serious, possibly even life-threatening. From the upper abdomen to the back of the knee, each of these spots is connected to conditions like heart disease, cancer, blood clots, or organ failure. And while the pain might feel small, the consequences of dismissing it can be huge. Stay with me until the end because you might recognize one of these signs in yourself or in someone you care about, and knowing when to act could save a life. Let's get started. Number 1, ache in the upper abdomen. An ache in your upper abdomen might seem harmless at first, just a bit of indigestion, maybe something you ate. But for older adults, especially those over 60, this kind of pain can sometimes be the earliest sign of pancreatic problems, including pancreatic cancer. What makes this ache particularly tricky is that it's often vague. It doesn't feel sharp, and it doesn't always come with nausea or fever. It may feel more like a dull pressure or a tugging sensation just below your rib cage. Some people notice it more after eating, others feel it when lying on their back. Either way, it's not intense enough to ring alarm bells, and that's exactly why it gets missed. The pancreas sits tucked behind the stomach, and early signs of trouble there don't usually show up in obvious ways. But doctors have seen time and time again that one of the first signals people report, often in hindsight, is this mild, nagging upper abdominal ache. Take the case of Gerald, a 72-year-old man who mentioned to his wife one morning that he had a weird feeling in his stomach, not quite pain, just a sort of pressure. He thought it might be heartburn. But after a few weeks of it coming and going, he finally brought it up at a routine checkup. His doctor ran a few tests, and within a week, he was diagnosed with stage 1 pancreatic cancer. They caught it early. That ache saved his life. If the ache you're feeling is steady, dull, and doesn't go away with antacids or food changes, or if it radiates to your back, it's worth asking your doctor about it. Especially if it comes with other signs like unexplained weight loss, a loss of appetite, or a change in how your stools look. The thing about the pancreas is that it's quiet. It doesn't yell when it's in trouble, it whispers. And you have to know how to listen. That's why this upper abdominal discomfort, even when it seems minor, should never be brushed off as just gas or just age. Don't let something treatable turn into something dangerous. If the ache is persistent, unusual for you, or just doesn't sit right in your gut, literally or figuratively, don't wait. Get it checked. A simple scan or blood test might be all it takes to rule something out or catch something early. Number 2, ache in the lower back. A dull ache in your lower back might be one of the most common complaints among older adults, but it can also be one of the most misleading. We often assume it's just stiffness, a bad mattress, or maybe a pulled muscle from doing something we shouldn't have. And in many cases, that's exactly what it is. But not always. There are times when lower back pain is trying to tell you something far more serious, something that's not in the spine at all, but deeper, your kidneys, or even the largest blood vessel in your body, the abdominal aorta. Kidney-related pain often starts as a vague ache just below the rib cage, off to one side. It may feel like it's coming from your back, but the source is internal. If you're dealing with a kidney infection or even a developing kidney stone, the discomfort can begin quietly. There may be no fever, no burning when you use the bathroom, just an ache. Something you notice more at night. Something that keeps showing up in the same spot. And then there's something even more critical to be aware of, an abdominal aortic aneurysm. The aorta is the main artery that runs through your chest and abdomen. In some older adults, especially men over 65 with a history of smoking or high blood pressure, the walls of this artery can weaken. As it bulges, it may not cause any obvious symptoms at first, just a nagging ache in the back, often misdiagnosed as a pulled muscle or arthritis. One man, Frank, 79, had been living with what he thought was mild sciatica for over a year. It wasn't severe, just an off-and-on discomfort he felt when bending or standing too long. During a routine scan for an unrelated issue, his doctor spotted an aortic aneurysm. It hadn't ruptured, but it was close. The ache in his back had been the only sign. These types of conditions often develop quietly. They don't start with a bang, but when left alone, they can progress quickly and become life-threatening. That's why noticing the difference matters. If your back pain is always in the same place, doesn't improve with rest, or seems unrelated to any physical strain or injury, it's time to take a closer look, especially if it's accompanied by other changes like difficulty urinating, blood in the urine, swelling in the legs, or a pulsing feeling in your abdomen. Sometimes, the key clue is how your body reacts to common treatments. If heat pads, stretching, or physical therapy aren't helping and the ache keeps returning or worsening, that's when you need to step back and ask, could this be something more? A simple ultrasound or CT scan can often spot these issues early. There's no need for guesswork, and early detection makes all the difference. Whether it's managing kidney health, removing a stone, or monitoring an aneurysm before it becomes dangerous. We spend a lot of time learning to live with discomfort as we age. But not every pain deserves patience. Some deserve attention, especially when they're trying to protect us from something far worse. You know your body, and when something in your lower back feels strange, new, or persistent, listen closely. That quiet ache could be a quiet warning. Number 3, ache in the center of the chest. It might start as a tightness not crushing, not sharp, not dramatic, just a mild, dull ache right in the center of your chest. Maybe when you're climbing stairs, maybe while walking after a meal, or sometimes even when you're just sitting in your favorite chair. For many older adults, this kind of chest discomfort is easy to brush off. But doctors warn that this very sensation is often the first clue of something much more serious, angina, or the early stages of heart disease. Heart-related chest pain isn't always intense. It doesn't always feel like an elephant sitting on your chest. In fact, some of the most dangerous heart conditions begin with nothing more than a sensation of tightness, heaviness, or pressure that lasts for a few minutes and then goes away. That's why so many people ignore it, thinking it's gas, muscle strain, or just a side effect of aging. Take Marlene, 74, who began feeling this kind of discomfort when she walked to her mailbox each morning. It wasn't painful, just enough to make her stop and catch her breath. She mentioned it casually during her annual checkup, not thinking much of it. But her doctor sent her for a stress test, and it turned out she had significant narrowing in 2 of her coronary arteries. They treated it before she had a heart attack. That little ache was the warning. Here's what's happening inside your body during angina. Your heart isn't getting enough oxygen-rich blood during moments of activity or stress. It's not failing, not yet, but it's struggling. And your body is letting you know in the only way it can, by creating a sense of discomfort right in the middle of your chest. This kind of pain may also radiate. Sometimes it moves into your shoulders, arms, neck, or jaw. Other times, it feels like it's just sitting there not doing much, but returning at the same times each day. That pattern, that repeat discomfort, is one of the clearest signs something's going on. Pay extra attention if this ache comes with other subtle signs. Shortness of breath, fatigue, lightheadedness, cold sweats. These symptoms may be easy to write off on their own, but when paired with even the smallest bit of chest tightness, they deserve your full attention. Another critical point, older adults, especially women, often experience heart symptoms differently than younger people. What feels like indigestion, anxiety, or even a pinched nerve may actually be your heart signaling distress. That's why getting checked out early is so important. Your doctor can perform a few basic tests, an electrocardiogram, a stress test, or a simple blood draw to check for markers of inflammation or damage. None of it is invasive. All of it can provide vital information. And the benefit of catching it early? You can treat it before it turns into a heart attack. You can make small lifestyle adjustments, take simple medications, or undergo a minor procedure that could give you years of stronger, safer living. So if you feel that tightness, that heaviness, that dull ache that seems to appear at the same times or under the same circumstances, don't wait for it to become unbearable. Don't wait until you can't ignore it anymore, because by then, it may be too late. The heart doesn't always shout. Sometimes, it just nudges you softly, quietly, hoping you'll pay attention before it's forced to scream. Number 4, ache in the jaw or left shoulder. When it comes to heart problems, most people expect the pain to be in the chest. But what many older adults don't realize is that the heart doesn't always play by the rules. Sometimes, the first place it sends its distress signal is somewhere entirely unexpected, like the jaw or the left shoulder. You might be going about your day chewing your food or talking on the phone and suddenly feel a dull, nagging ache in your jaw. Or maybe after carrying a bag of groceries, your left shoulder starts to throb. Not sharply, not severely, but enough that you take notice. If you've had this happen and chalked it up to tension, arthritis, or old joints acting up, you're not alone. But you also might have missed a sign that your heart was asking for help. This phenomenon is called referred pain, one of the most misunderstood aspects of cardiac symptoms. When the heart is under stress, due to blocked arteries, restricted blood flow, or even early signs of a heart attack, it can cause discomfort in places that seem unrelated. The jaw and shoulder, especially on the left side, are two of the most common. Consider the case of Linda, 68, who went to her dentist because she'd been feeling a strange ache in her lower jaw for 2 weeks. There was nothing wrong with her teeth, no infection, no dental problems. But her dentist, who had seen this kind of thing before, told her to see a cardiologist. Within a week, she was being treated for significant coronary artery disease. The same goes for the left shoulder, a persistent ache that doesn't seem tied to movement, doesn't get better with rest, doesn't respond to usual treatments for arthritis or strain. Especially if it comes on with mild exertion, could be your heart's way of waving a red flag. This type of pain is often sneaky. It's not sharp. It doesn't stop you in your tracks. But it returns, maybe not every day, but often enough that it becomes familiar. And when it comes with other subtle symptoms like shortness of breath, fatigue, or a strange sense of unease, it's time to listen. Doctors emphasize this especially for women who tend to experience non-traditional heart symptoms more frequently than men. Jaw discomfort, neck pain, and shoulder aches are all signs that when seen in isolation don't seem alarming. But taken together, they paint a very different picture. You might think, I've had this kind of pain before. That's fair. But this is about what's new, what's different, and what doesn't follow the usual patterns. If your jaw aches without chewing or your shoulder hurts, even when you haven't lifted anything, those are the aches that matter. It's also important to notice how quickly the pain resolves when you rest. Heart-related pain tends to ease when the heart is no longer under stress. That's why people with angina often find their discomfort disappears when they stop walking or climbing stairs. If the ache goes away with rest but comes back with exertion, that's a clear signal. A quick conversation with your doctor, a simple heart test, or even an EKG can often rule out something serious. But waiting, guessing, or hoping it'll go away on its own, that's a gamble you don't want to take. You've lived long enough to trust your gut. And when your jaw or shoulder tells you something feels off, even in the smallest way, listen. Number 5, ache in the lower right abdomen. There's a very specific kind of ache that shows up low and to the right of your belly. It doesn't scream for attention. It's not sharp enough to double you over, but it's persistent. It's odd, and it has a way of making you feel like something just isn't quite right down there. For older adults, that minor discomfort could point to something more serious than people often assume, like appendicitis, or, in some cases, a hidden issue in the bowel that's slowly brewing beneath the surface. Most people think appendicitis is a young person's condition, and it's true. It's more common in younger folks. But it can and does happen later in life. The difference? In seniors, the symptoms are often much more subtle. No fever, no vomiting, just an ache that hangs around your lower right abdomen, may be coming and going, may be worsening when you press on it or move around too quickly. Take Alan, 76, who felt a slight ache in that spot for nearly 2 weeks. He kept thinking it would go away on its own. He hadn't eaten anything strange, wasn't constipated, and didn't have a fever, so he figured it was just a muscle strain. By the time he went in, the appendix hadn't burst, but it was close. The surgeon said if he'd waited even another day, it could have been a very different outcome. But here's where it gets more concerning. That same area of the abdomen is also where symptoms can appear when there's something wrong with the intestines, particularly the cecum, the first part of the large intestine. Conditions like cecal volvulus, diverticulitis, or even early-stage colon cancer can begin with nothing more than an ache. No blood, no major changes in digestion, just that persistent low ache you can't quite explain. When to worry? If the pain shows up after meals, is accompanied by bloating, cramping, or a feeling of fullness, even when you haven't eaten much, or feels deeper than typical muscle soreness. These are signs your gut is trying to flag something down. And let's not forget, our bodies change as we age. Nerves aren't always as reactive. Immune responses slow down, and symptoms don't always follow the textbook. That's why we have to become our own best observers, paying attention to patterns, not just pain levels. Women especially need to be cautious with this area because lower right abdominal aches can sometimes be misinterpreted as gynecological issues, and vice versa, ovarian cysts, infections, and other conditions can all radiate similar discomfort. Bottom line, if the ache is new, doesn't go away, and feels like more than just a passing annoyance, it's time to speak up. Your doctor might suggest imaging like a CT scan or ultrasound, simple, non-invasive tests that could give you peace of mind or help you catch something early while it's still manageable. And here's the key, don't downplay it just because it doesn't feel bad enough. With abdominal pain, not bad can still be bad, especially when it's been hanging around longer than it should. Number 6, ache behind the knee. It's easy to overlook a little tightness or soreness behind the knee. Maybe you bent it wrong. Maybe you sat too long. Maybe it's just one of those aches that come and go. But there's one specific condition that doctors warn older adults about, and it often starts right there, behind the knee with nothing more than a dull, nagging ache. Deep vein thrombosis, DVT. DVT occurs when a blood clot forms in a deep vein, most commonly in the legs. And while it can happen without any pain at all, one of the earliest signs, especially in older adults, is an ache behind the knee or in the lower leg that doesn't go away. It might not be painful to the touch. It might not swell at first, but it lingers, and it feels just a little bit off. What makes this spot especially dangerous is that clots that form in the legs can break loose, travel to the lungs, and cause a pulmonary embolism, a life-threatening blockage that often strikes without warning. But before that happens, the body does give clues. The key is knowing what to look for. Meet Richard, 81. He noticed a soreness behind his right knee and thought it was from driving long distances, so he ignored it. But after a few days, the leg started to swell slightly. Still, he didn't think it was serious. On the 4th day, he got winded climbing the stairs. That was enough for him to visit his doctor. Blood tests and a quick scan confirmed it. A clot had formed. It was caught in time, and medication cleared it, but if he had waited longer, it might have been a different story. How to tell DVT from ordinary aches? It's often a pressure or heaviness, not sharp or sudden. May feel worse when bending your knee or walking. Sometimes the skin is warm to the touch or slightly discolored. Key sign, one leg feels different from the other. Older adults are at higher risk for DVT due to slower circulation, less activity, surgeries or long periods of sitting, travel, history of smoking, or high blood pressure. What to do? Move regularly, flex your ankles, stretch your legs. If the ache is persistent or one leg swells, don't wait, ask for an ultrasound. Prevention matters, stay hydrated, avoid sitting 1 hour without stretching. That little ache behind your knee might be nothing, but if it's a clot forming deep in your leg, it's something you want to know about before it lets you know the hard way. Number 7, ache in the pelvis or groin area. When you feel a little soreness or pressure in your pelvic area, especially as you age, it's tempting to shrug it off. Maybe you think it's a pulled muscle from getting out of the car the wrong way, or tightness from sitting too long. But when that ache lingers in the pelvis or groin, especially if it seems disconnected from movement or doesn't improve over time, it could be your body's quiet way of pointing to something far more important. For older men, this type of discomfort can be an early sign of prostate trouble. It might not be a sharp pain, just a sense of fullness or mild pressure, particularly when sitting. And often, it shows up long before the more well-known signs of prostate issues, like difficulty urinating or frequent nighttime bathroom trips. Case in point, Dennis, 75, first felt a low, dull soreness whenever he sat on a hard chair for too long. It wasn't painful, it didn't interfere with his daily life, but something about it felt different. After months of ignoring it, his daughter insisted he get it checked. Tests showed his prostate was enlarged with early signs of cancerous changes. Because they found it early, he had options. For both men and women, pelvic aches can also signal bladder conditions, A, G, cancer, infections, hernias, gynecological issues, A, G, ovarian cysts, cancer, bowel disorders, red flags. The ache is always in the same spot, feels internal/deeper than muscle strain. Comes with changes in bathroom habits or blood in urine. Women, take note, postmenopausal pelvic discomfort, even when mild, can be an early signal of ovarian or uterine changes. Don't assume it's just aging. Action steps. Track the ache's patterns. When it appears, what makes it worse? Ask for a physical exam plus imaging, ultrasound/CT if it persists. Never ignore fullness or pressure that's new or worsening. Your body speaks in whispers before it screams. These 8 aches from the upper abdomen to the groin are its way of waving a small flag before raising a big one. Remember? Harmless pains that don't follow usual patterns deserve a second look. Early detection turns scary diagnoses into manageable ones. You've earned the right to advocate for your health. Don't downplay what you feel. If this resonated with you, comment below with which point surprised you most. Share with someone over 60 who needs to hear this. Subscribe for more Straight Talk health insights. Your vigilance today could rewrite your health story tomorrow. Stay proactive, friends.